Hey, Dr. Troy here. A lot of patients ask me, hey, what's Nucca? Well, Nucca stands for National Upper Cervical Chiropractic Association. It's a group of doctors that practice a similar technique that focus solely on this bone right here. This is called the atlas, also known as the upper cervical region. And if you look right through that big hole, foramen magnum comes off the skull, which means big hole. Your lifeline goes right through this hole. This is the bone Christopher Reeve broke, which really affected all kinds of stuff. Also, the two holes, the two smaller holes, deliver 80% of the blood supply to your head. So if this vertebra shifts out of alignment, it can interfere with nerve flow, blood flow, cerebral spinal fluid flow. This can even be associated with visceral stuff like indigestion, breathing, gut issues. We've even seen patients with sciatica that have had atlas misalignments. So really the upper cervical movement or group is people who focus on correcting the atlas misalignment. Nucca is one technique. There's orthospinology. That's one of the techniques that we use in our office. They're very similar. They have very similar concepts, just a different nuances and tweaks on how they deliver the method. But the concept is still the same, to take the pressure off the spinal cord, to reestablish the connection between the brain and the body so the healing messages flow again. Now, one of the number one signs that the atlas is out of alignment is a supine leg check, where we lay the patient on their back, we check their leg length to see if there's any discrepancy. We can use head rotation because the spinal cord attaches to the atlas with the dentate ligaments, and we can challenge these things to see, is the atlas actually out of alignment? Very low cost diagnostic test compared to all these big imaging centers, thousands of dollars being spent on imaging, when a simple leg check test that costs nothing can actually determine a lot about the internal environment of your body and if you're vibrating at a high frequency to express health and healing and function. So that's my thoughts on Nucca, upper cervical, some of the different techniques, hole-in-one, there's Grostic, orthospinology, which is the one I use. So this is Dr. Troy talking about upper cervical and Nucca.